Liver disease in pediatric patients, that means liver disease in children, is increasing gradually over a period of last few years. And what we are finding is a lot of kids who are born with anomalies or deformities in the liver. So, and with the advancement of the medical science, we are able to treat these kids successfully if we can diagnose them well in time and offer the right kind of treatment well in time. So most common causes of liver failure in kids are kids born with biliary atresia, that means the bile ducts not formed, which ultimately leads to liver failure, or metabolic liver disease, or certain infections and autoimmune liver disease, which ultimately leads to liver failure. So this kid was actually born with biliary atresia. There was no bile duct, and very soon the liver started to fail, and after 7 days of birth, the baby had jaundice, which kept worsening. And by the time the baby came to us, she was 8 months old, and she was having water collection in the belly, jaundice, was not gaining weight, unable to eat well, and was having discomfort. So we started treating her, and we explained the family that the only way to save the child is to do liver transplant, which they agreed, and they started arranging the finances and the stuff for the care of the baby. And it took, because they were from a different country, to get here and to arrange everything, it took them around 1.5 months. But by the time the baby came, the baby was in a very bad situation, was requiring ventilatory support for breathing, was requiring feed through the nose tube to build the nutrition, and was in very critical shape. So it took us around 10 days to stabilize the baby, but since it was in a very critical situation, and we realized if we don't do the transplant, the baby will not survive. So we took her up as an emergency transplant. Father donated part of the liver, and the next challenge for us was to put in a small part of the liver from father's body to baby's belly. Since the baby was very small, so we had to reduce the liver, and we implanted a part of the left lobe of the liver from the father's body in the baby's body. After the transplant, again the course was very stormy, because the baby was very sick to begin with, was on a ventilator support, the lungs were weak, the whole body was weak, nutritionally deficient. So it took us around 10 to 14 days to get her out of the respiratory support. So she was out of the ventilator in 4 days, but to get off the complete support, it took us 10 to 14 days. After that, we started her on immunosuppressive medicines and nutrition. Gradually, baby started to recover, and by day 25, she was discharged from the hospital. They were in the country for a while before going back, and by the time baby went back, she was absolutely well. Now she has come back for a follow-up after 5.5 months, and I'm glad to see that she's developing well, and she's gained weight, and she's playing with her siblings, and her milestones are developing like a normal kid now. So now we have explained them how the quality of life of this baby is going to be, and how to improve that for future, so that she can live like a normal kid in her life.